Wound care with Betadine Paint. So Betadine Paint in my practice is generally reserved to treat dry gangrene. So if you've had a mastectomy, for example, and you're having mastectomy skin necrosis, meaning the skin that was left behind after your mastectomy didn't have enough blood flow and it underwent necrosis, it can eventually turn black, which is called dry gangrene. So whenever there's an area of the skin that develops dry gangrene due to necrosis, we will initially treat that area with Betadine paint. This is 10% Betadine paint. You paint it on, it turns the skin orange, and what that's doing is it kills most of the bacteria that could be living on the skin, because our goal is to preserve that dry gangrene as long as possible. I know that sounds gross, but what we want to do is let the tissue underneath and the tissue around that area heal for as long as possible. Because if the skin died due to lack of blood flow, which is what causes dry gangrene, that means the skin around that black area doesn't have very good blood flow either. Meaning the skin at the edge of the black necrotic tissue was barely alive at one point in time, but had barely enough blood flow to pull through and survive. So that skin is certainly not ready to accept any sutures or the tension of wound closure. So what we want to do is buy time. We want to buy time to let the tissue around that black area heal and increase blood flow as much as possible. We buy that time by having you apply Betadine paint to the black necrotic area to prevent it from getting infected. As soon as it gets infected, then it becomes soft and mushy and we have to cut it out and throw it away. But we want that to happen never, or at least as far into the future as possible. Meaning the goal is to let the tissue around that black area heal as much as possible and get as strong as possible, so that we can simply cut out the black area and sew everything back together. So the purpose of the Betadine paint is to prevent infection and buy time so we can cut out the black dead tissue and sew you back up. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.